Have you ever wondered how the government helps in the early growth and learning of young children? Republic Act No. 8980, also known as the Early Childhood Care and Development Act. What is this law all about? It focuses on giving children ages 0 to 6 years old the best start in life through proper health, nutrition, early education, and social care. This law ensures that every Filipino child grows healthy, smart, and ready for school.
Section 3. Objectives of the National ECCD System. Improve infant and child survival rates through accessible health and nutrition programs, enhance total child development, physical, social, emotional, cognitive, psychological, spiritual, and language, strengthen the role of parents and caregivers as the child's first teachers, ensure smooth transition from home to school or community-based settings, improve skills and standards of ECCD service providers, support poor and disadvantaged communities in promoting ECCD programs, prepare children for formal schooling that meets their developmental needs, establish systems for early identification, prevention, and intervention of developmental disorders, and promote quality standards in ECCD programs through accreditation and registration systems.
Section 4, Definition of Terms. This section divides the key terms used in the ECCD Act. These terms help us understand how early childhood programs work together to support children's total development. Early Childhood Care and Development System, the ECCD system, means all programs and services that meet the holistic needs of children from birth to age 6, including health, nutrition, education, and social services. It aims to promote children's overall growth and development. Two main types of programs. A is center-based programs. These are organized in a community or school setting. Number 2 is ECCD service providers. ECCD service providers, these are the people who take care and teach young children in ECCD programs. They can be professional, para-professionals, or volunteers. For number 3, ECCD curriculum. CCD curriculum provides age-appropriate learning experiences and materials that help children develop holistically. It includes national goals, learning activities, and guidelines suited to the child's needs, background, and culture. For number 4 is parent education. This refers to programs that teach and guide parents on how to raise and educate their children effectively. It provides parents with information skills and support system to help them become better caregivers and educators.
The ECCD system includes 5 components according to the Section 5 of the Republic Act. First is ECCD curriculum. ECCD curriculum focuses on the total development of every child, which is physical, mental, emotional, social, and cultural. Also considers each child's individual needs and social cultural background. ECCD curriculum integrates services like healthcare, nutrition, sanitation, education, and cultural activities. Also uses the child's first language as the medium of instruction. Second one is parent education, involvement, and community mobilization. It strengthens parents' roles as primary caregivers and teachers. These components encourages parents to participate in ECCD activities and decision makings, and also promotes advocacy and teamwork among parents, community members, and stakeholders. The third component is Human Resource Development Program. These components aims to professionalize ECCD service providers through training and education, and includes pre-service and in-service training, continuing education, and distance learning. Also establish a registration and credential system for ECCD workers. The fourth component is ECCD management. These components focuses on planning, implementation, supervision, monitoring, and evaluation of ECCD programs. It also involves parents, service providers, and local officials to ensure sustainability. ECCD management guided by decentralization, meaning local governments help manage and support programs. The last component is quality standards and accreditation. Ensure all ECCD programs meet national quality standards, and accreditation is done by the National ECCD Coordinating Council, and also monitors and evaluates centers, service providers, and curriculum quality.
Section 6. Establishment of ECCD system. This section stated the ECCD system will be set up gradually across the country. Each year, it will be established in at least 3 regions, as chosen by the National ECCD Coordinating Council. The goal is to have the program running nationwide within 5 years. It means the ECCD system will be expanded step by step until it reaches all regions in the Philippines. Section 8. Creation of National Coordinating Council and Coordinating Committees for the ECCD. This section focuses on coordination and collaboration. It says that the National Coordinating Council and Committee at the provincial, city or municipal and barangay level must be organized.
As for the Section 9 Financing ECCD Program, ECCD program at the community level shall be financed through a combination of public and private funds. All public and ECCD program providers shall prioritize young children from families who are in great needs and who can least afford private sector's programs. Part 1. Government support. The law says that the government should support ECCD programs, especially in poor areas. This is done through cost sharing between local government units or LGUs and the national agencies. Funds come from things like municipal development funds or help from donors and national organizations. Private and workplace support. Private groups and companies are also encouraged to help. They can support ECCD by providing facilities, covering operating costs, or running programs at work for employees' children. Good news for the companies, if they don't charge users fee, they can deduct the cost from their taxes. Part 3. Role of the families. Yes, they may be the small users fee, but the law says they should be affordable and reasonable. If parents can't pay, they encourage to help in other ways like volunteering, donating time, and service.